Whether you're a client in pain or the practitioner treating them, one thing is always true. We all want the results to last. You know that blissful feeling that you have after a massage and you walk out feeling amazing and then you actually start to stiffen up, even sometimes on the car ride home. That is so unfair, isn't it? Or how about the long-awaited relief that you feel from joint pain after you've had a steroid injection? And the pain relief maybe lasts 3 days, maybe 3 weeks if you're lucky, and then what? You're back in pain again. Today, we're going to talk about 3 of the key components to longer lasting pain relief. And I wish that I could say permanent pain relief, but let's face it, the human condition is one that is prone to accidents, and we are also prone to degeneration and wear and tear. So we're going to talk about how to achieve longer lasting results and preserve your body so that you can play harder and longer. If you're a health practitioner who treats pain, or you're someone who is struggling with pain and looking for a more natural way of taking better care of your body, make sure that you subscribe and hit that notification bell so that every time we release new content, you are notified and you don't miss a beat. We're going to be covering lots of hot topics on natural health and pain, and I can't wait to dive into today's topic. As a naturopathic physician, it is my job to look for the root cause of someone's dis-ease. And so when I think about someone in pain, I think in terms of anatomy, physiology, biochemistry, pathology, epigenetics, immunobiology, and so much more. As you can see, it's a really complex world inside your beautiful body. So here's an overview of the 3 key components to longer lasting pain relief. Number 1 is structural integrity. To keep it simple, that means that the leg bone has to be connected to the hip bone, and that the nerves, arteries, veins, muscles, fascia, everything has to be aligned and in nice proper order in order for everything to function properly and feel good. But the lower extremity is a much simpler beast than the upper extremities. For instance, did you know that your arm is only attached to your axial skeleton right here at the acromioclavicular joint? That's right. The only reason that your humerus is able to stay in the glenoid fossa of your arm is because of the interplay of the balance between your pectoralis muscles and the rotator cuff muscles. So, how do we achieve optimal structural integrity? Yoga, Pilates, even physical therapy exercises can help you work on building the strength and the alignment to maintain your posture and to sit and move properly. You can find someone like a good chiropractor, naturopathic doctor, or osteopathic doctor who's trained in manipulation, who can help adjust your body so that you're in proper alignment. But I'm going to be honest with you. I don't really like to go to someone who takes my neck and just wrenches it in one way and then wrenches it in the other. A really good anatomist can palpate each and every vertebra and feel the forces on it and know exactly which vertebra is out and in which direction that one vertebra needs to move in order to get back into place. So, if you find someone who is capable of giving you those more delicate adjustments, that's a fabulous find. Speaking of delicate adjustments, another great therapist to have in your wheelhouse is someone who's trained in craniosacral therapy. You can find a lot of massage therapists, naturopaths, and other practitioners who are familiar with the art of craniosacral. Craniosacral focuses on the craniosacral rhythm that is produced by the flow of cerebral spinal fluid from the brain and the cranial bones all the way down through the spinal column. A good craniosacral therapist can detect your craniosacral rhythm in your pinky toe. And it feels wonderful to have the trauma sort of unwind in the body. Another practitioner that you should really know about is someone who's trained in a type of bodywork called myofascial release. We have what are known as the anatomy trains, or basically patterns of how our connective tissue is held together and how those layers formed as we formed from an embryo, from a 4-celled organism to an 8-celled organism, 16 cells, 64 cells, and so on. Our connective tissue forms these layers so that basically we know that if we release the connective tissue holding the pectoralis in place, that the shoulder is able to go, thank you, and find its proper place and release that chronic tension back there in the neck and shoulders. So how does dynamic neuromodulation help you maintain structural integrity? I'm so glad you asked. Theoretically, the activation of the C fibers, little difficult to excite nerve fibers in your cutaneous skin surface, travel to the right and left anterior insula of the brain, which is the center of homeostasis. Homeostasis is the overall brain's awareness of, like, how am I doing as an organism? And this is one of the ways, and one of the only ways, that I can explain the thousands of self-adjustments that I've seen after someone has had a treatment with one of these devices. I've seen clients at home, I'm talking to them on the computer, and they treat their neck and they turn to the right to see who's there, and we hear kapow, we hear the neck adjust. I have clients who, one of my clients, her husband treats her spine in a very detailed fashion on a regular basis once a week, and then she goes to her traction table and she says that the number of adjustments, noises, we call it zygopophysio releases, it just blows her mind. You know, I've seen hips adjust, knees adjust, sciatic joints adjust. I even felt my own talus, my ankle bone, adjust once after I sprained my ankle pretty badly, and I was treating the ankle, and I felt my talus literally kind of pop back out into better alignment. One time I thought I almost broke my hand when I was treating my shoulder joint for chronic dislocations, and my shoulder kind of flew back into place and my hand hit the counter as I was going. Fixed my shoulder and broke my hand at the same time. Just kidding. That is one of the ways that dynamic neuromodulation works to improve structural integrity. And the other way is through the fascia. And that's a topic that is really near and dear to me. You will be seeing a video from me on the secrets of our fascia here soon. But our connective tissue, our fascia, is considered by some to be the second electrical system of the body, a system that can actually transmit electrical impulses and sort of communicate, if you will, inside the body. And that is based on Dr. Becker's work. But I'll get into that in a future video. But when the current travels through our fascia, the body is able to better organize itself because we're sort of feeding the body that energy that it needs to heal. The second key to long-lasting pain relief is achieving a form of a neural reset. There's something called a conditioned nociceptive response, which basically means that our synapses have the ability to store information for long periods of time. Now that's helpful when you have to remember that the stove is hot when it's on, but it's not helpful when your brain, your synapses, now think that sitting in a chair is the enemy and that's going to cause pain, because the memory or the condition of thinking that it's going to cause pain is often going to cause more pain. So the synaptic neuroplasticity is believed to contribute in a lot of ways to what we call hyperalgesia, or a hyper response to painful stimuli. And yes, the pain is real to the person who's feeling it. It is just that the nervous system has conditioned itself to be more receptive to pain. Did you know that chronic pain can even be considered a neurodegenerative disorder to some degree? That's right. Studies have shown that people in chronic pain have more neurodegeneration or brain death within the prefrontal cortex of their brains. And so the pain creates the death of those cells, which creates more pain. So unfair, right? And then there's also the issue of hypervigilance. Hypervigilance means that you're anxious that pain is going to occur. And studies have shown that in healthy subjects, as well as subjects in pain, that the amount of pain that they anticipated was going to occur from an event was the amount of pain that they experienced, even when the actual stimuli wasn't as painful as they anticipated. So, how do we achieve a neural reset and sort of calm and reprogram our own nervous system? That is a complicated question, but I'm going to do my best to give you some guidance on how to achieve that. One of my first suggestions is EFT. It stands for Emotional Freedom Technique. And it is a technique of tapping in certain areas of your brain and your hands and saying certain things as you go along and do this. So I'm not going to explain EFT to you today on this video, but it is something that you can definitely Google. There's lots of free resources out there. And if you've never tried it, it doesn't hurt anything. It's not going to cost anything. You might as well give it a shot, because it's not something that I would have ever believed in until I had clients who were getting all kinds of relief from it. So worth a shot. Other ideas: cognitive behavioral therapy, going to see a therapist who's going to help you work through your mindset in certain situations can help as well. EMDR, eye movement desensitization and reprogramming, is another technique that a proper therapist can help you with in order to sort of reprogram your body's response to certain stimuli. Acupuncture can also achieve a bit of a neural reset within the body. It's known for helping to balance that parasympathetic sympathetic state. And if you don't mind needles, we could go even bigger and go into neural therapy. Neural therapy is a German technique that I was trained in that involves injecting a local anesthetic, mostly procaine, because procaine is non-toxic to the body and it breaks down into things that are actually nutritive to the nervous system. Using procaine and injecting it into scars, into big ganglion or nerve plexuses within the body, into the trigger points, into teeth sockets, you name it. The user often experiences what we call kind of a procaine high after being treated with neural therapy. And one of the things that neural therapy does, that injection of procaine resets the resting membrane potential for those nerves. That means that they are calmer, basically, that they're less likely to fire off pain signals in response to normal stimuli. And finally, you guessed it, dynamic neuromodulation can help to reset the nervous system because we're using parasympathetic shaped waveforms to kind of trick the body into thinking that it's its own parasympathetic response. So the recipient of dynamic neuromodulation within 3 to 5 minutes typically starts to feel more relaxed. Their digestive noises, the borborygmi start to kick up, and we know that we've got that person back into a healing state of mind. This can really help explain why so many of my clients have gone home after their first treatment or two and taken a 2 to 3 hour nap. It's because the nervous system has finally gone back into that relaxed state, and the brain says, I just need you to lay down for a little bit so that I can do the work that's needed to really heal this body. And the third key to achieving longer lasting pain relief is to reduce that inflammation. Talk about a loaded subject, right? First, let's look at some of the ways that the traditional medical community lowers inflammation in the body. Most typically, they prescribe an NSAID, known as a non-steroidal anti-inflammatory. And that could be something like Celebrex, diclofenac, indomethacin, even ibuprofen and naproxen. There are many others, and the most common issue with the nonsteroidal anti-inflammatories is that they can work, they inhibit that enzyme cyclooxygenase to reduce inflammation, but at the same time, they have an increased risk of heart attacks, strokes, gastric bleeding, kidney issues, and liver issues. Is that a good long-term solution for chronic pain? The other most common traditional approach to lowering inflammation is to inject those painful joints with corticosteroids. Next week, we are going to go into a deep dive into the ugly truth about steroid injections. But for now, let's just say that there are occasionally really good indications and good uses for steroid injections, but they are used far too commonly and often very poorly indicated. There are other ways that we can achieve a much better result. So what are some of the natural ways that we can lower inflammation? Well, there's diet. And one of the simplest ways that you can reduce inflammation with your diet is to reduce your consumption of white flour, white sugar, red meat, and dairy, especially if those latter two are not grass-fed. One of the second ways that we can reduce inflammation is using essential fatty acids. Omega-3 fatty acids can also inhibit the same enzyme that NSAIDs do, the cyclooxygenase enzyme. We also have proteolytic enzymes, things like bromelain from pineapple or pancreatic enzymes that we can take away from food to get in there and break down products of inflammation within the body. We also have essential oils, and essential oils, I'm going to really caution you, you have to know what you're doing with them. Some of them can be used topically, some of them need a carrier oil, some of them are best inhaled, and there are very few that you can actually ingest orally for an anti-inflammatory effect. Other ways of reducing inflammation naturally, CBD, really common, and there's some actual research to back it up. It's not a bad choice. There are also a lot of different herbs, from boswellia to curcumin to rosemary, that we can take to reduce inflammation within the body. And finally, you guessed it, dynamic neuromodulation. How does dynamic neuromodulation lower inflammation in the body? The electrical impulses that are sent from the device will actually trigger the production of our enkephalins, bradykinins, endorphins, all of our anti-inflammatory neuropeptides. Plus, we can use certain techniques that involve some kind of aggressive circles right at a bony surface or bony ridge to sort of irritate the periosteum, which is the lining of the bone. And when we irritate the periosteum, we are stimulating the release of certain powerhouses in the body known as calcitonin gene-related peptide and platelet-derived endothelial growth factor. I know that was a lot to take in, and I know that my writing on a whiteboard is not the prettiest in the world, but hopefully you're taking some notes at home. I'll also leave a pretty detailed section of notes in the description below this video so that you can take a look at that and not have to squint to see my whiteboard. But did you notice the one modality that was common in all three keys to longer lasting pain relief? That's right, is dynamic neuromodulation. Now, there might be a few other things that can achieve a structural reset, a neural reset, and lower inflammation. And if you have one that you love that does all three, please leave me a comment and let me know all about it. Are you a health professional listening to this right now and thinking about your own toolkit and what you use with your clients? You know, I'm a big believer that it takes a village. There isn't just one perfect modality. There isn't just one perfect way of treating everybody. Everyone is individual, and there are always different causes for pain. But I am a big believer in having dynamic neuromodulation in your toolkit because it is so versatile. You know, even stem cell injections can work really well for a while until the person goes back into the activities or the lifestyle that caused the degeneration to start in the first place. And are you someone at home thinking, yeah, this makes sense. No wonder I feel the way I do. Don't give up hope. You know, we can start with small changes that can start to have a big impact. I've had this device in my life since 2013. It has gotten me through several severe ankle sprains, 14 years of chronic neck and shoulder pain. I do believe it is the #1 modality that has helped me avoid having shoulder surgery on my right shoulder like I had to do on my left. I was a serious whitewater junkie back in my 20s and blew both shoulders out kayaking in Big Rapids. And as well, it has helped me with off-label uses of the device, things like energy, digestion, even my complexion. But it's not the only modality that I use in my life to stay healthy. I eat a whole foods diet with tons of fruits and vegetables and almost zero cane sugar. I like to read every single day to do something good for my mind and work on gratitude and meditation. I exercise on a daily basis in various forms of exercise and breath work. I hire coaches when I need to help me get through a rough spot. And I strive every single day to live my best life. So, what are the things that you do to maintain your long-lasting, feel-good, pain-relieving, health-promoting, way of life that keeps you going so that you can do the things that you want to do and feel great doing them? Let me know in the comments below. If you click on See More below, the description will drop down and you'll find the links to our programs for health professionals and the general public, for anyone who's interested in how dynamic neuromodulation can help you improve your overall health and achieve longer lasting pain relief. And be sure to check out this video on 5 reasons that dynamic neuromodulation can outperform TENS. And if you're interested in learning more about who I am and why I'm talking to you today, click on this one here. Thank you so much.